this is the flexion and this is the extension. Okay, this is the abduction and this is the adduction. Distances are equal on both the limbs, then this discrepancy must have come from the supratrochanteric origin, maybe as a result of osteoarthritis. Rest of your fingers, palmar surface of the fingers behind the tibial tuberosity. Okay, and then you have to press the tibia anteriorly. The examination of the hip, that will start by the gait, that is you will have to ask the patient or the subject to walk few steps for you, then please try to walk along the patient and then provide necessary support if needed, and there may be the actors who will produce some antalgic gait. Okay. So next you have to ask the patient to turn around and walk over the heels and walk over the toe tips. You have to ask the patient to lie down and then palpate the hips. Okay, so palpate the both hip joint, and before palpation you have to ask the patient whether he or she has any pain in any of the hip joints, and you have to always start examination or palpation from the normal one. If the patient tells that pain in the right, then you have to start with the left one and just palpate the joint contour, joint line. So it is better to start from the either going above downwards or below upwards. So if you want to go above downwards, then palpate the iliac crest first, then up to the iliac crest just go a little bit downwards and laterally with the hip joint and then the trochanters of the femur. Okay. So after palpation, before obviously you are looking at the temperature and then this tenderness, and what we call is the limb length discrepancy in case of hip joint. And for the apparent limb length, we all these instruments or appliances will be provided in your exam hall, so don't even get worried to take this along with you. So for apparent limb length discrepancies, it might be started from the GP-sternum up to the medial malleolus, and or you can start from the umbilicus up to the medial malleolus, because you do not have to tell the original figure of this length, rather you have to tell the length discrepancy. Suppose I have found this left leg is 2 centimeters shorter than the right one, and this is the relative one, and the absolute or true LLD is measured from the anterior superior iliac crest up to the medial malleolus. Okay. So after, if there is any discrepancy, then you have to determine whether it is subtrochanteric or supratrochanteric in origin. But if both the limb lengths are equal, you do not have to get to the Galeazzi test or this determination. So if you have to determine whether this is supratrochanteric or subtrochanteric, then just identify the greater trochanter and measure up to the tibial tuberosity. Okay, so greater trochanter up to the tibial tuberosity, and if the distances are equal on both the limbs, then this discrepancy must have come from the supratrochanteric origin, maybe as a result of osteoarthritis or avascular necrosis of the femoral head due to previous trauma or whatever it is. Okay, so this is the important point in case of hip palpation. And then the movements of the hip joints. Then movements of the hip joints, you have to ask the patient. Remember one thing, that you cannot use the medical terms as the flexion, extension, abduction, adduction. So you can use that, would you please bend your knees, or bend your hips towards your head, or bend your knees towards your head, and then straighten this. Okay, then again stretch this, and please produce the same on the left side. Okay, so please try to produce the same movement simultaneously on the both limbs, one after one on the both limbs, so that you will not miss the contralateral side. So if you first ask about flexion, then ask about the flexing the right one, then the left one, or the normal one and the affected limb. So produce same movement on the both limbs and then proceed to the next. So you can have flexion and extension, and then ask the patient, would you please spread your both legs apart from your body. So this patient will simultaneously abduct both the legs or both the hips together, and then please get those back in the midline, okay, or get those back in the previous position, whatever you like to tell the patient in the exam hall, but just in the layman languages, okay. So internal and external rotations, it is preferred to produce passively, not actively, and when you produce this movement passively, before that you have to tell the patient that now I am going to produce these movements, or I am going to move your hips by myself, and I assure you that you should not have any discomfort. If you feel any pain, just let me know, okay. Then the flexion of the hip, just whenever you are producing any passive movement, don't forget these are the key points, okay, because those who fail to succeed in the exam, those are not because of they have missed any point. Most of the cases they forget or they escape these key points, that because your examiner will look towards those points, that whether you have put your left hand over the joint, whether when while you are producing the passive movements or not, okay. So produce when we are going to make the passive movements, then you have to keep your left hand over the hip, and then this is the flexion and this is the extension, okay, this is the abduction and this is the adduction, and just flexing, this is external rotation and this is the internal rotation, okay. So you have to feel for the crepitation and the range of the movement, okay. In case of osteoarthritis or any other arthropathy, this movement may be a little bit difficult, or the joint might be stiff, suggesting the limited range of motion, okay, limited range of motion. And after movement is completed, we have a special test to perform in case of hip, that is we know the Thomas test, okay, the Thomas test. So before doing the Thomas test, we have to keep a hand, the palm of the left hand under the lumbar spine to compensate the lumbar curvature, and then you have to ask the patient to fully flex both of the hip joints, okay, and the knee joints, and then you have to ask to straighten one of the legs one by one. First, just ask to straighten the left one completely by patient himself, and if he could extend the hip, then there is no flexion deformity, and then again ask to flex both, and then the next one, the right one, okay. So this is the Thomas test. If there is any osteoarthritis or avascular necrosis of any of the hip, there will be a flexion deformity of that particular hip, and after full flexion, this subject will not be able to extend that limb fully, okay. So this is the hip examination. Next will be about the knee examination. So knee examination will start with the gait, then walking few steps in normal, then turn around, then coming or walking over the heel, and then over the toe tips, whichever you prefer to do first. And then you have to tell the patient to stand, and you have to look the knee joint from the front, from the lateral aspect, and from the back. Front, lateral aspect, from the back, for the points we have just mentioned, such as joint swelling, joint deformity, any signs of inflammation, such as redness or erythema or any scar mark, and from the back on the popliteal fossa for any popliteal fossa masses, okay. And then you have to ask the patient to lie down, okay, and then start the knee palpation. This is the very important. Among these 6 stations we have mentioned, if you are to grade top 3, one is knee, one is ankle, another is spine and lower limb neurological examination.